Hi, I'm Becky Livingston, and I'd like to welcome all of you to Firefit and for joining us today. As you probably know, Firefit was originally developed with firefighter fitness in mind, just to ensure that all firefighters have a really good fitness regime, which includes some of the objectives being having a year-round balanced fitness program and also minimizing injuries that are directly related to PT.
My name is Katie Sell, and today Becky and I will be introducing some assessments for areas of physical fitness pertinent to firefighter function, as well as highlighting some of the safety precautions when administering these assessments.
Higher than average level of overall fitness is recommended for firefighters in areas of fitness important for optimal job performance and overall health. This suggests a comprehensive yet time-efficient battery of fitness assessments is also recommended. There are many benefits to conducting physical fitness assessments. Assessing physical fitness increases the likelihood of a fitness program being able to achieve the desired fitness improvements or maintenance of current fitness. Assessments also provide valuable information on current fitness status and identify weaknesses in overall fitness. They can also serve as baseline scores or can be used to monitor progress through an exercise program. However, before commencing with physical fitness testing or beginning an exercise program, it is important to remember important safety precautions. This introduction will highlight some simple, commonly used physical fitness assessments for body composition or obesity level, aerobic fitness, muscular strength, endurance and power, flexibility, and core fitness.
Body composition can be assessed using several different methods. Laboratory-based approaches include underwater weighing. However, skin fold measures or bioelectrical impedance analysis can be conducted easily in the field. Bioelectrical impedance analysis or BI analysis can be conducted using BI analyzers. However, an individual must be sufficiently hydrated and have followed pre-testing guidelines for this approach to be most accurate. Some common assessments of major lower and upper body regions for range of motion include the sit and reach test and various dynamic shoulder assessments. As with many assessments, the sit and reach test can be administered with or without specialized equipment. When conducting any test for range of motion, care should be taken to avoid ballistic, jerky movements, and several measures should be taken for each assessment with the highest score recorded. Joint-specific assessments can be conducted, but should be done so by a trained professional to ensure accuracy. Additional assessments for specific regions can be administered following the proper training. These may include, but are not limited to, the Thomas test and the waiter's bow. Common assessments used to assess muscular power include explosive jumps such as the vertical jump or broad jump. The vertical jump can be administered with or without specialized equipment. When conducting explosive assessments, be sure to emphasize correct landing technique to avoid potential injury and allow for several warm-up trials. One should also record the highest score. Common tests to evaluate muscular endurance include the bent leg sit-up or curl-up tests and various versions of the push-up test. Typical protocols for these tests may involve completing as many repetitions as possible in 1 or 2 minutes, or performing the maximum number to fatigue. Alternative tests include the pull-up test, or performing standard weightlifting exercises such as the bench press with as many repetitions as possible using a set weight. Muscular strength tests are somewhat muscle region specific. Various resistance exercises such as the bench press and leg press can be used to assess muscular strength by evaluating how much weight can be lifted through 1 repetition. However, this type of testing, known as 1 repetition max testing, should be attempted only by healthy, experienced lifters and be administered by trained professionals. Correct form must be adhered to in order to avoid potential injury and to maximize lifting capabilities. An alternative test for muscular strength is the hand grip test conducted using a hand grip dynamometer, which should be administered to the right and left side of the body. There are many ways to assess aerobic fitness. Run and or walk tests that involve covering the maximal distance possible in a given time frame, or recording the time it takes to cover a given distance such as a mile or mile and a half, are easy tests to administer. Run or walk tests typically require minimal equipment, can be administered relatively quickly, and require no specialized training to administer. Step tests, bike tests, or even swim tests are also available to estimate aerobic fitness. The choice of modality and test protocol, such as a submaximal or near maximal effort test, depends upon personal preference, age, equipment availability, and current fitness status and health status. The following assessments are important for evaluating core fitness. This implies core strength and endurance, as well as core stability. The core is comprised of multiple muscles located throughout the torso and hip region. Therefore, assessments targeting the core region should address the abdomen, back, and lateral portions of the torso. If comparison values for these assessments are not available, then test scores should be examined for imbalances, such as differences in score values on the right and left sides of the body. Common assessments for evaluating core strength or endurance include side and back planks, sit-ups or curl-ups, arch-ups, and static abdominal muscle trunk flexor assessments. Tests for evaluating core stability assess whether the torso can maintain postural control when put off balance. Generally, these tests do not have comparison values but can provide valuable information on current core stability status. An assessment battery derived from the assessments that we discussed in this introduction has been implemented in wildland firefighters throughout Utah and New Mexico over the last 2 years. This was introduced in an effort to provide these firefighters with a measurement tool to evaluate their current and baseline physical fitness and to be able to develop a program to either improve or maintain upon these fitness levels.
Thank you so much for joining us, and we really encourage you all to rise to the challenge and follow in their footsteps.